Did you know that Bernie Sanders' state of Vermont tried to basically do a medical for all for the state of Vermont? They celebrated that bill, and I would have too, but basically it failed. Why did it fail? Because the cost of healthcare went way up, and the cost of healthcare was too high, and they couldn't afford it no matter what they did. And so basically, the state had to cancel that. So, what has Bernie Sanders done since then? Nothing. He hasn't figured out how to control the cost of healthcare. He just assumes that a medical for all would actually control the costs. But when he did it statewide, it didn't. It didn't at all. And so the assumption that a single payer system would control the costs failed in the state, would work in the federal. It might, but we don't know that. So what we need is a plan to actually control the cost of healthcare. What we need is a plan to bring down the cost of healthcare. What we need is a plan to lower prescription drug costs. What we need is a plan to rein in costs. What we need is a plan to control doctors' costs. What we need is a plan to have open cost that is transparent so that you can shop around and basically know what you're paying before you decide. And what we also need is the AMA to not monopolize the medical schools and cause a supply problem which rises the cost of labor, but to open up medical schools like all the other schools that we have. You know what? I've been saying this for a long time, and you know the only candidate who says these things? Andrew Yang. Andrew Yang is the only one who's talking about the AMA, and American Medical Association. Andrew Yang is the only one talking about doctors' costs. Andrew Yang is the only one talking about making the cost of things transparent. Okay? And so there's a lot of elements to bringing down the cost of healthcare that Andrew Yang is proposing that you can read on his website, yang2020.com, that no one else is talking about. And so once again, Bernie Sanders, state of Vermont, tried Medicare for all, and it failed because they didn't control the cost. And Bernie Sanders is not doing anything, nor is anyone else doing anything to solve that problem, except for Andrew Yang. If you want universal health care, if you want Medicare for all, if you want a single payer system, the way to get there, the best way, and perhaps the only way, is through electing Andrew Yang.